Hi, I'm Linda. What is the panel's view of the King's Fund verdict that the NHS reforms have wasted billions?
You follow this, Scott Fletcher. What do you think of it?
Yeah, well, A&S, my business has been working with the NHS since before inception. I was a consultant doing IT systems, and to be honest, it's horrendous. Every single new government that comes in changes the NHS. We've had FHSAs, PCGs, PCTs, you name it. There's always a different organisation to deal with, and I think we've got to settle with something and try and improve it, not by top-down reorganisation all the time, because all that happens is you're moving the chess pieces around. So I totally agree that what we're saying in the report.
Molly Scott Cato.
There are many reasons that the people in this country have lost faith in their politicians, but I think one of the worst aspects of it is a government saying, or rather before the election, the Conservatives saying clearly there will be no top-down reorganisation, and then immediately introducing such a thing. It is so dishonest and cynical that it really beggars belief. And not only that, when it's perfectly clear that it isn't what the people in this country want, that we really value a public health service where there's no profit motive involved, and to actually go to fly so totally in the face of what the people want so soon after you've promised to do the opposite, I think is just it just completely undermines people's faith in their politicians, and it really threatens democracy itself, I think. I think the King's Fund also said, and this is something where I'm now going to have a go at Labour as well, that actually the PFI deals were a part of what's gone wrong also in our health service. It's such an enormous waste of public money. The same report told us that...
Just to remind people the PFI deal.
This is where, instead of paying for a new hospital out of direct public investment, you organise a financial deal and then you rent the hospital premises back effectively. And the King's Fund said that we had spent £63 billion on new hospitals because of the PFI deal, whereas they would have cost £11 billion through direct investment. So it's an absolutely shocking waste of money, and the Green Party is completely clear that the profit motive should play no role at all in the provision of health.
Chris Ham, the Chief Executive of the King's Fund, said the first 3 years of coalition government were wasted years because of the misguided focus on organisational changes that have only recently been compensated by this renewed emphasis on safety, quality and greater integration. Billions of pounds will have been wasted on those misguided reforms. By way of answering this question to start with, that's the verdict. Do you accept the verdict, Grant Shapps?
The King's Fund also said...
I'm going to
answer your question, but let me just point out what they said, because you've read one selective quote, and I just want to give you another part of their quote, which was that they said that public dissatisfaction with the NHS has reached an all-time low. In other words, people are more satisfied with the health service. So this was actually a much more balanced report than perhaps some of the comments have suggested.
Funnily enough, last week we discussed the NHS, as one does a lot, and that point was brought out very clearly by panellists. Come to Linda, if you don't want to answer my question, answer Linda Earnshaw. What's your view of the verdict that reforms have wasted billions?
No, I don't.
His words.
Okay, I don't agree, and the reason is this. Although the reforms obviously cost money to do in the first place, they're now saving £1.5 billion a year. And the reason why I point to the public level of satisfaction in the NHS, in the King's Fund report itself, is because the people that I'd really like to hear from are the people using the NHS. All of those of us who use it all the time are the best people to judge the outcome. And just to clarify that, what we've done is to give the NHS over to the clinicians, to the doctors, to the nurses, to the experts who actually we would want running this organisation, rather than the politicians who used to run it. As a result, we've got 7,000 fewer managers managing the NHS, and instead, and I've got the numbers here, 9,000 more doctors, 5,000 more nurses, 2,000 more midwives. In other words, we're treating more people. It's now saving money every year, and as the King's Fund said, the focus is much more patient-focused.
They also said, so just to finish, just for you say you want it more rounded, the NHS at the end of the Parliament is experiencing both financial pressures and challenges in hitting targets that matter to patients because time, effort and money that should have been spent on patient care has been diverted into complex organisational changes. You seem to be saying those complex organisational changes were 100% justified and you're glad they took place and Andrew Lansley did a great job.
Well,
Is that the case?
I would take the view from the end of this Parliament, as I just said, we're treating a lot more people through the NHS, we've got a lot more doctors and nurses.
You're not saying you're saying that,
well,
but you repeated that. That's a mantra, as we well know, and it depends where your baseline is for the numbers you take.
2010 till today?
He says, I mean, that Jeremy Hunt is doing, is turning the thing round and it's much better. Do you accept the drive of what he's saying? You're saying, no, he's absolutely wrong, that Andrew Lansley was spot on, even though we didn't know about it before the election.
No one, I mean, the most ridiculous thing to do would be to say that look, everything that's happened over 5 years, absolutely perfect, no problems at all. With hindsight, of course, you do many different things. The point of this is that at the end of 5 years, we've got an NHS that we can be proud of, that's valued. And Simon Stevens, who's the chief exec of the NHS, has said that the 5-year forward view, the plan for the NHS, is the right way to go. And he's also pleased to say that the Conservatives are funding that, promising to fund that for the next 5 years and found the money going forward. We've had a real increase in the NHS budget of 12.7 billion, and Conservatives were the only ones who went into the last election promising to do that, a pledge that we kept.
What do you make of the King's Fund verdict, Lisa Nandy?
Well, I think, largely speaking, it's a disaster for the government, but much more important, it's a disaster, as it shows, for people who use the National Health Service. And Grant's right to say that we have an NHS that is worth valuing and supported. I wish that we could say the same about the politicians who are running it, because Jeremy Hunt and Andrew Lansley, until this afternoon, I thought were the only people who were still defending a £3 billion reorganisation that nobody asked for and nobody wanted. Now it appears that there's three of them. Grant is the third. And, you know, the truth is that this has destabilised the NHS, exactly as the King's Fund report said, at the very time when it needed to be stabilised and focused on patient safety. What we urgently need in the National Health Service is less pitting against one another in a competitive system and much more collaboration so that people can get the care they need when they need it. If you walk into any A&E department in this country at the moment, what you find is services stretched to breaking point. And the reason for that is that we underfund social care, we underfund primary care, so people struggle to get GP appointments, they struggle to get care in their own homes. There is a massive cost to the taxpayer around that, but there's also a human cost behind that we don't talk about very much. And if you want a really good example of where this marketisation of the NHS has been a disaster, you need to look no further than here in Stockport or in Wigan, where I'm an MP, and the outsourcing of patient transport to Arriva, undercutting the North West Ambulance Service. And what did that mean? It meant that patient dissatisfaction went through the floor and over half of people missed their hospital appointments. It's been a disaster. This mantra that private is best that we keep hearing from the government needs to stop and needs to stop now.
You say that. Can I just... I will tell you. You say that and you buy into what Chris Ham's report says. He also says about Labour that you are crying wolf, I quote him exactly, if you're arguing it's going to lead to the widespread privatisation of NHS care. Less than 10% of the healthcare budget was spent on non-NHS providers. Are you going to give up the privatisation charge in order to achieve a much better debate?
No, we've never said that we're opposed to the involvement of charities or even private companies in aspects of delivering health and social care.
You say they want to privatise it.
And that, you know, I
do you think he wants to? Do you think Grant Shapps wants to privatise?
Well, that's what we've seen over the last few years. The health and social. If you just let me answer the question for a second, Jonathan. The Health and Social Care Act opens up the possibility of privatisation to any aspect of the National Health Services. And
so Ham's right on something.
Sorry, shows you that there are times when that is completely inappropriate.
Forgive me, I want to stick with
Ham.
You've praised Ham in age. You've said that what he says is a disaster for Tories. He says they opposed the bill, the proposals, for the reasons that Grant Shapps was asked to deal with. And then he said, you are crying wolf if you're arguing that the bill, is going to lead to widespread privatisation of the NHS. Do you accept that he's right when he says that? You don't seem to.
No, I have to say that respectfully I disagree with him, because actually if you read the report, although he does say once that it is crying wolf to suggest that this leads to privatisation. The report does underline the fact that what we've seen ever since that bill was passed was widespread marketisation and services being put out to tender that has not been in the best interests of either the National Health Service or patients.
There may be some listeners who think that you both cherry-pick those parts of ham that you like and discard those that you don't. Grant Shapps.
Well, I just wanted to understand from Labour, Lisa, the policy, because you said we shouldn't have politicians involved in the NHS. The Act that we passed took politicians out, and someone called Simon Stevens now runs it as the chief executive. You want to undo that, in other words, bring politicians back in other words, have a reorganisation. I'm confused because what you've done in Wales, where Labour actually runs the NHS, has devastated the National Health Service there with much longer waiting lists and people crossing into England to get their help. And I'm also confused because for all your misguided accusations that we somehow want to privatise the NHS, is not true at all. You were the ones who ran all these PFI projects which have been criticised, and the only ever party to privatise a hospital in the NHS. So I'm confused where you're trying to go with this and whether, in fact, you're telling the whole truth.
Well, maybe I can help you understand, Grant. So, as the King's Fund report makes absolutely clear to everyone apart from you and two of your front-bench colleagues, putting clinicians and patients back in control of the NHS is not the problem. The problem is when you impose a top-down reorganisation.
But you're about to do that if you undo the
billion. We
Care
absolutely
Act.
Are not. We've said we will not do that, and we will knit the system back together in the interests of patients and in the interests of the people who use the National Health Service. But the truth is that the argument isn't about whether you put clinicians and patients back in control of the National Health Service. The argument is about who you do it and in whose interests. And what we've seen since your government came to power is services pitted against one another in a competitive system when they should be collaborating in the interests of patients, and we would stop that.
But this is a service that now gets far more patients through the system and spends £12.7 billion more.
I just wonder if you've been in an A&E recently,
which is an increase,
tried to get a GP appointment, or waited for an operation.
Everyone remembers the reason
Seems
that we're in this mess.
Completely divorced from the reality.
Everyone remembers that the reason we're in this mess with A&Es is because of the GP contract that you guys signed in 2004 that stopped the GPs working in the evening and the weekend, something that we are reversing.
What these two are kindly proving is my original point, that actually both of them, and the Liberal Democrats too, in fact all three of the Westminster parties, are implicated in a privatisation of the health service that none of us wanted, and that is completely undermining our faith in them. So that they may argue with each other about who was more responsible, but they both introduced the private principle into healthcare. In Labour's case, I think, we've seen recently John Hutton and Alan Milburn coming out and defending what they did, but we're deeply suspicious of the way that was done. There was definite hints of cronyism and personal enrichment, and that's undermined even further our confidence.
Sorry. Let's be very careful about what one says. I think you said something that you may not... if Sue Grab It and Run came for you, you may not wish to find yourself there in the court.
Certainly people who introduced policies that later they were able to join the boards of those companies.
Yeah, but it does not mean that they introduced the policies in order to enrich themselves.
OK, but certainly they made money out of the policies later, and I think that does raise questions about exactly what their motivations were.